Hello everybody, my name is Nate Liberty and I'm going to be telling you guys a little bit about the opioid epidemic. The first thing I'm going to address is when the opioid epidemic became a problem. I'm going to tell you a little bit about what we know about the opioid epidemic. 20 to 30% of the patients that are prescribed opioids for pain become addicted. About 80% of the people who use heroin nowadays started with prescription opioid painkillers. I did a little bit of research about the Midwest, and from the Midwest, they include the states of Chicago, Minnesota, North Dakota, South Dakota, Nebraska, Iowa, Missouri, Arkansas, and those 7 or 8 states I just said. They found that a 70% increase in overdoses have been found from July 2016 to September 2017. Now back to when it kind of became a problem. Back in the 1990s, pharmaceutical companies told us and doctors that their opioid drugs would not be addictive. With that, doctors started to prescribe more and more opioid drugs, which led to a slow rise in opioid overdoses in the next 20 years, which is nowadays. Now I'm going to tell you guys a little bit about the different types of opioids, basically the different drugs that there are. The first one is fentanyl. Fentanyl is the most potent out of all of the opioids that there is. It's 30 to 50 times more lethal than heroin. One of the little deals I read was 0.25 milligrams, not even grams, 0.25 milligrams is enough to kill a person, no matter how big. Obviously, if you're a baby, it's a little bit more, and if you're a little bit bigger, it's a little bit more than that. So maybe 0.25 to 0.3. It's very, very small amount of fentanyl can kill somebody. The next one, that's the second most lethal, is heroin. It is a semi-synthetic derived from morphine and from the poppy plant. The third one is oxycodone. It's otherwise known as Percocet. Has different has various strengths, is 5 through 25, 10 through 25, and then by itself at 5 milligram and 10 milligram. Morphine is the next one. It is one of the only natural opiates that there is, naturally derived, I should say, naturally derived opiates that there is. The next one is hydrocodone. It's otherwise known as Vicodin or Loratab. It's most commonly found mixed with Tylenol or acetaminophen or APAP, whatever you would like to say. It's usually found in 325, which is 5 milligrams of hydrocodone, and 325 milligrams of APAP. There's 2 other ones, 7.5 to 325 and 10 to 325. Those are the kind of 3 common ones that there is. And the next one would be codeine. It's usually found with Tylenol in a tablet form, which is otherwise known as Tylenol 3. And the last one for codeine would be cough syrup. That's usually Phenergan with codeine, and the street name for it would be lean or along those lines. The last one that I kind of thought was popular is tramadol. It's one of the weakest opioids, but it is commonly abused by the community. Next, I'm going to go into the stats on the deaths from opioids. Mostly, you would think that opioids would be the number one for deaths and hospitalizations, but alcohol is the top one. Opioids come in second or third in most of the counties across the United States. I'm going to be talking a little bit about the stats of Nebraska for the past decade, since most of us are from Nebraska or we're going to school in Nebraska, so I figured this would be pretty fitting. In 2005, there was 2.4 deaths per 100,000 people, and then in 2016, there was 2.2 deaths per 100,000 people. Nebraska is actually ranked last in the state rank of opioid overdoses. In fact, in the last 15 years, Southeast Nebraska has ranked second to last compared to the rest of Nebraska in opioid overdoses. Douglas County is actually second, I believe, from what I was reading, for opioid overdoses, and then the Panhandle is the lowest, which considering there's usually more cows out there than there is people, so that would kind of make sense. One of the things that Nebraska has done to kind of stop or try to stop this epidemic is they have a system for prescription drug monitoring, and this basically tracks the drugs that are prescribed and dispensed from the doctors and through the pharmacist. I was kind of looking up the ways that we can go ahead to try to prevent the amount of overdoses and hospitalizations, and I was reading up on the United States Department of Health and Human Services, and I found 5 major priorities that they are trying to focus on for this epidemic. The first one is improving access to treatment and recovery services. The second is promoting use of overdose reversing drugs. The third one is strengthening our understanding of the epidemic through better public health surveillance. The fourth one is providing support for cutting edge research on pain and addiction. The fifth one is advancing better practices for pain management. I didn't think that was too much, so I went ahead and tried to find another one, and I did another place to look to try and help stop this epidemic, and I found the National Institute of Health, and they're talking about what new ways to go about this epidemic, along with the Department of Health and Human Services. And the first thing that they found was safe, effective, and non-addictive ways to go about chronic pain management. The second was new and innovative medications and technologies to treat the opioid overdose. And the third one was improved overdose prevention and reversal interventions to save lives and better support recovery. That's all I have to say. So if you have any questions or comments, leave them below. And thanks for watching.